Let's discuss some scenarios for transitional care management medical decision making. A 70-year-old patient with acute exacerbation of CHF has been discharged from the hospital. Your staff performs and documents TCM contact with patient within 2 business days after discharge and schedules a visit within 14 calendar days. Patient is concerned about a 9-pound weight gain since discharge. Nurse discusses the patient's concern with provider who increases patient's Lasix medication. He also orders daily weight and blood pressure checks by a home health agency. You've been treating the patient for the past 20 years. You perform an office visit and discuss the patient's recent test results. Since his CHF is not stable, you recommend the patient enroll in cardiac rehab. Documentation for this established patient includes review and summary of past hospital stays, review of labs and radiology. This documentation supports ordering or review of 3 labs or tests which qualifies for a moderate complexity level of data reviewed. Your assessment and plan includes documentation of acute exacerbation of CHF. You note patient's blood pressure has been stable. This documentation of 1 condition worsening and 1 stable condition supports a moderate level of diagnosis and management options. You document you prescribed Lasix for your patient and your recommendation of cardiac rehab. The risk of complications, morbidity or mortality for this patient is moderate. Since at least 2 of the 3 elements met a moderate level of medical decision making, TCM code 99495 moderate medical decision making would be appropriate to bill. A 52-year-old female was discharged from the hospital 5 days ago for SIRS, leukocytosis and uncontrolled DM. Your staff performs and documents TCM contact with the patient. Patient states since discharge she has had diarrhea and feeling her heart is racing. Physician sees patient for an office visit within 7 calendar days of discharge. Patient states she has had diarrhea since discharge. She has occasional dizziness and has fallen twice, resulting in broken eyeglasses from a recent fall. Caregiver relates patient has not been out of bed for 2 days, complaining of generalized weakness. Patient has not been monitoring her sugar, and has not taken her psych medication for a couple days. She is suffering from severe dehydration and you call an ambulance to take her to the hospital. Documentation for this established patient is extensive. You check the patient's glucose. You also check her heart rate. You document finger stick in office is 200 plus. Dry. HR 120. Clinically dehydrated. Essential hypertension stable but tachycardic in the 120s. Your assessment and plan includes uncontrolled type 2 diabetes mellitus without complication, without long-term current use of insulin, HCC code. Poorly controlled diabetic with finger stick in office of 200 plus. Diarrhea, unspecified type. Unclear etiology. In addition, you document severe dehydration. Patient sent to hospital for reevaluation and rehydration. This documentation of 1 established problem worsening, 1 established problem stable, 1 new problem being worked up, and 1 new problem with no workup meets the level of high complexity medical decision making. Documentation of severe dehydration for your patient requiring an immediate hospital visit qualifies as high risk. An acute illness posing threat to life or bodily function, patient severe dehydration with hospitalization, meets the high complexity of medical decision making for TCM services. Since at least 2 of the 3 elements met a high level of medical decision making, TCM code 99496 high medical decision making would be appropriate to bill. Contact LVPG Compliance Education if you would like more information on transitional care management services.